Among the 12 major types of childhood cancer, leukemia, that is blood cell cancers, and cancers of the brain and central nervous system account for more than half of the new cases. About 1/3 of childhood cancers are leukemia. The most common type of leukemia in children is acute lymphoblastic leukemia. The most common solid tumors are brain tumors, with other solid tumors being less common.
Well, it's certainly well known that mothers who smoke during pregnancy tend to have less healthy babies. That is a clear-cut factor. Mothers who use alcohol or misuse other drugs during pregnancy also will have less healthy babies. As far as cancer itself is concerned, there is no such genetic predisposition. Or if the child is not growing well, then the child should be checked up. If cancer is diagnosed, one should not despair, because there are many cancers which nowadays are curable, even in children, in adults, and in the old age.
The causes of childhood cancer are largely unknown. A few conditions such as Down syndrome are specific chromosomal and genetic abnormalities, and ionizing radiation exposures explain a small percentage of cases.
Majority of the cancer is due to the environment. There is a certain number of cancers which can run in families. For example, there is a special type of breast cancer which tends to run amongst families because they have a certain genetic composition. There are other cancers which have got no genetic connection at all. And essentially, if you look at each organ type of cancer, you will find a very small proportion which have a genetic background. Majority is environment.
Environmental causes of children cancer have long been suspected by many scientists, but have been difficult to pin down, partly because cancer in children is rare and because it is difficult to identify past exposure levels in children, particularly during potentially important periods such as pregnancy or even prior to conception. In addition, each of the distinctive types of childhood cancers develops differently, with a potentially wide variety of causes and a unique clinical cause in terms of age, race, gender, and many also believe it's a lifestyle disease. But what does the medical field say?
Well, definitely cancer is a lifestyle disease, because if you take the example of lung cancer occurs in people who smoke. So definitely smoking is a risk factor for cancer. So in that manner, lifestyle is important in the development of cancer. For sure, in countries which have banned smoking and in countries where smoking is not prevalent, you find that the incidence of lung cancer is low.
Childhood cancer may be dangerous to a child, but what have studies shown about the possible causes of childhood cancer? High levels of ionizing radiation from accidents or from radiotherapy have been linked with increased risk of some childhood cancer. Children with cancer treated with chemotherapy or radiotherapy may be at increased risk for developing a second primary cancer. Recent research has shown that children with AIDS, like adults with AIDS, have an increased risk of developing certain cancers. Certain genetic syndromes have been linked to an increased risk of specific childhood cancer. Children with Down syndrome have an increased risk of developing leukemia. Pesticides have been suspected to be involved in the development of certain forms of childhood cancer based on interview data. No consistent findings have been observed linking specific occupational exposures of parents to the development of childhood cancers. Each year in the country, approximately 12,500 children get diagnosed with cancer. Precisely 1 out of 300 children in Africa develop cancer before they attain the age of 20. Manuya Kevin, GBS.